Hey folks, Dr. Ryan here with ChiroBalance Spine and Sport. Today we're going to talk about some shoulder issues. Commonly what I see is either pain in the front of the shoulder or in the back of the shoulder. Most commonly this is caused by a miscommunication between the glenohumeral joint or the joint. Hey folks, this is Dr. Ryan with ChiroBalance Spine and Sport. Today we're going to talk about some shoulder problems, shoulder pain. Typically what I see is either pain in the front of the shoulder or in the back. Typically this is caused by a miscommunication between the glenohumeral joint, which is the shoulder proper joint, and the scapulothoracic, which is your shoulder blade and the rib cage. When there's a miscommunication there, it can cause tightness in a couple of muscles. Your shoulders get pulled forward with bad posture, which tightens down specifically lats, pectoralis major, and subscapularis. Also lengthens the rotator cuff, lengthens the rhomboids, so they aren't working as well as they should, and then turns into a compensation pattern which just feeds itself. So Derek and I are going to go over some exercises and some treatments that you can do at home.
Hey, what's up guys, Dr. Goat here. So we're talking about shoulders today. Shoulders are really important because oftentimes we use them incorrectly without really knowing. For example, when you're texting, you're hunched over. If you're on the computer all day and you don't have a proper ergonomically set up workstation, you're actually hunched over and you're straining muscles without really knowing, and later on you're going to have some pain and you're like, oh my gosh, this really hurts, what do I do? So we're going to talk to you a little bit about shoulders, and what's so special about shoulders is it's actually one of the least stable joints in your body in terms of structure. Unlike your hips, which have a deep socket, your shoulders don't. And to tell you more about that, Dr. Slaughter is going to tell you what he knows, and we'll go from there. Go ahead, man.
So like Dr. Coe said, the shoulder joint is more or less a golf ball sitting on a golf tee. There's not a lot of stability there. So your shoulder relies on muscles to do a majority of the stability. When there's muscular imbalances, because we're sitting and our shoulders are pulled into a forward posture, like I said earlier, those muscles get shortened, the muscles in the back get lengthened, and it causes improper wear and tear on the shoulder. So to balance those out, we need to do a combination of releasing the tight muscles and giving you exercises to strengthen the muscles that are unstable.
Cool. So if you're watching this video, you might be looking for exercises to help stabilize your shoulder or to help ease some of the pain. But most importantly, after you leave our offices, we generally give you a lot of exercises to do. And it's a little overwhelming, so if you can use this as a review as to the stuff that we gave you, that would be perfect. And that's what we're going to aim to do.
Alright, so a couple of exercises we're going to go over today mainly involve pulling your shoulders out of a forward rolled position. First one we're going to go over is a wall angel. Dr. Coe is going to demonstrate for us. What I want you to do is put your back up against the wall, keep the head against the wall, low back against the wall. Step out just a little bit more, good. Arms by your side. I want you to keep wrists, elbows, shoulders, and back all up against the wall this whole time. Reach up over your head as far as you can without letting any of those joints come off of the wall. And then back down, bring the elbows to the side a little bit more. See how his wrists are coming off the wall here? I want him to come back to just past where he comes off of the wall and hold that position right here. Feel a good stretch for 1 or 2 seconds and then come back down to your side and start over. One more all the way up as far as you can, keeping the back up against the wall the whole time. Come back down, pinch the elbows to the side. Wrists start to come up, hold there, try to push the wrist into the wall and hold for a second, and back down. Do that 10 times, you'll really feel a good stretch through the shoulders, through the pecs here, down the arm. Another one is taking a lacrosse ball up against the wall and working into that pec muscle. Anytime you find a tender spot, I want you to hold pressure on it for 20 to 30 seconds until the muscle starts to release. Pain should start to go away. You want to demonstrate that one as well?
Sure.
And we'll do the left shoulder.
Left shoulder?
Yeah.
So
Face the wall a little bit more. Good. Put as much pressure as you feel comfortable with. Find a tender spot and just breathe into it. Good. Alright. So typically what I ask people to do is find 2 or 3 spots, breathe into it for 30 seconds, and then that's the repetition for the day. The third one is a lower trap activation and a stability exercise. So what I'm going to have Dr. Ko do is face the wall in a slightly staggered stance. Have the shoulders up on the wall, keeping the back nice and wide. Keeping the elbows on the wall, keeping the back nice and wide. The rest of the spine is locked in. I don't want you moving through the back at all. It should all be coming through the shoulders. I want him to reach in a Y formation while keeping the shoulders down as far as he can, and then back down. Good. Go back up. Should be a 3 to 4 second up and then 3 to 4 second down. And we would have you do these 3 times 10 repetitions. There you have it, folks. If there is any pain with any of these exercises, please stop what you're doing, give us a call, and come make an appointment with us so we can figure out what the cause is and get a little bit more of a manual approach to it. Number is 408-329-7774. Look forward to hearing from you.
Thanks for watching. If you liked our video, make sure you hit subscribe. That way you'll be the first to know when we upload the next one. And if you can do us a huge favor, go ahead and give us a thumbs up. Every click counts. Well, until next time.